Okay. Hi, good afternoon. Thank you all for coming to our monthly public health grand rounds here at Johns Hopkins, sponsored jointly by the Mid-Atlantic Public Health Training Center and the State Health Department. Today's talk on Maryland addresses youth cigar use is especially timely. As we decided what to do in the month of November, we know that it's the Great American Smokeout is in the middle of November, so we said, well, we definitely want to talk about smoking. And then we said, well, what could we bring to the audience? And then we realized that Maryland really is the leader in thinking about youth cigars, so what better topic than this one? Before I introduce you to today's speakers, I want to draw your attention to some of the other activities that we have coming up. We have a grant writing seminar coming up on December 11th all day, and team building the next day. We also have many other activities, and I'd encourage you all to look at our website, which is www.jhsph.edu/MAPHTC. We will not have grand rounds in the month of December because it's a holiday month, but we will again be back together the third Wednesday in January, so stay tuned for what's coming. For those of you who are watching online, I'd like to encourage you all to submit questions as our two panelists today are speaking. And all you need to do is click on the link, which will directly go to our email address, which we'll be monitoring the whole time. Please also fill in the sign-in sheet so that we can know who you are and make sure we invite you to other further activities. So without further ado, I'd like to introduce you to two speakers today who work together closely, so we're really in for a treat for a seamless afternoon. And who also will talk with us about two different ways of looking at the same very significant and growing problems. Dawn Berkotitz is an MPH and a community health educator who has been at the State Health Department for almost 16 years, very involved in multiple different projects around smoking. So there are probably very few people certainly at the State Health Department who understand better what is going on with tobacco in our state, as well as the different programs that we hold. Unfortunately, she did not do her public health training here at Johns Hopkins, but Tulane is a very good friend of ours, so we're glad to have you with us today, Dawn. She will be followed by Carlo DiClemente, who is the UMBC Presidential Research Professor, who has his PhD north of here from University of Rhode Island. He has spent his entire professional career looking at health and addictive behaviors and is very interested and committed to clinical services research. He has authored a number of books in the areas of behavior change and around addictions, and really is very well versed in the research in this field and in addictive behaviors in general. So without further ado, I'd like to introduce Dawn, who will then pass the baton over to Carlo. Thank you.
Thank you so much for that introduction and for having us here today. We are pleased to talk about what we have done here in Maryland, the scope of the cigar problem among our youth, and what we have begun to do to address it. And before I start, I just want to talk a little bit about this slide that is up here, because when most people and most adults think about cigars, they think about the large, premium, expensive cigars that are more associated with older men smoking. And that's not what we're seeing the youth smoking. We're seeing them smoke these smaller flavored cigars like the Swisher Sweets and Black & Milds that have the white tip, the white plastic tip, and the white apple. So these are smaller, cheaper cigars they're sold in a variety of fruit and candy flavored. So that's really what we're talking about here today. And why did we target cigars? So we've been very successful here in Maryland over the last 10 years to really reduce our cigarette smoking rates among youth through programmatic efforts, through environmental and policy change efforts. And as we've seen this reduction in cigarette smoking, we've seen an increase in cigar smoking. And these are the primary reasons. So cigarettes now, since the FDA passed the act in 2009, are not allowed to be sold in fruit and candy flavors, where cigars are very prevalent in chocolate, vanilla, strawberry, peach, mango, grape. We also have a cigarette tax at $2 a pack, and when we started this campaign, cigar taxes were at 15% of the wholesale price, and to be equivalent to that $2 per pack, it would be at 70% of the wholesale price. They're also sold singly, which also makes them affordable, whereas cigarettes are required to be sold in a minimum pack of 20. And many are unaware of the dangers of cigar smoking. They feel this is a safer alternative to cigarette smoking, and that they're marketed in these colorful packages and flavors that are attractive to youth. So all this together has led to increased cigar smoking among youth. And here's the data we found in our youth tobacco surveys in the state. So whereas when you look back to 2000, the cigarette smoking use among youth was nearly double what it was for that of cigars, we have seen a 40% decrease in cigarette smoking between 2000 and 2010, and at that same time period, about an 11% increase among cigar smoking, making cigarette and cigar smoking among youth nearly identical now at 11%. So this was certainly a concern for us. And when we drilled into the data a little deeper, this is what we found. So 80% of youth that were smoking cigars were purchasing flavored cigars in the flavors that I mentioned before. 3/4 of them were purchasing cigarillos, so those are the small cigars that like the black and milds. 65% were purchasing less than 4 at a time, with 50% just purchasing 1 at a time. So this makes them much more affordable, much easier. You don't have to hide a whole pack of cigarettes from your parents. You could share them with your friends with pocket change. And we found out that youth weren't smoking necessarily just cigarettes or just cigars, but nearly 20% were smoking them both at the same time. We saw that a small percentage, higher, of Hispanic youth were smoking cigars, followed by African American and white youth, and the highest flavored cigar use was among girls and white youth. So we wanted to see if our state data really matched up with the national data, and we found that it certainly did. Between 1998 and 2007, we found that little cigar sales were up 240% across the country, and during that same time period, cigarillo sales were up 150%. And when we looked at our state data, we found that in Maryland, cigar sales overall had increased by 176% between 2000 and 2010, while cigarette sales had decreased by about a third, by 34%. So there was a big dichotomy there. Also, about 20% of high school males were reporting smoking cigars on the national level, and cigar use was increasing among African American females. So we had this quantitative data, and we wanted to see qualitatively what was going on. So we were fortunate in Maryland. We have a statewide youth movement against tobacco use, and these are teen coalitions we have across the state. It's Maryland Trash, Teens Rejecting Abusive Smoking Habits. And we bring these youth advisory board members together quarterly. And a few years ago, 2-3 years ago, we asked them about this issue. And we found that the youth really across the state were very, very familiar with this. Everybody knew about cigars, and Maryland is often seen as kind of American miniature because we do have very rural areas, wealthier suburban areas, and urban areas. And we found that across the board, also boys and girls all knew of people smoking cigars. It was very prevalent, and one girl told us, "Oh yeah, you could get those out of the back of an ice cream truck for like 79 cents," which was really astounding to us that it was this prevalent and this accessible. We also heard that small convenience stores, independent fast food retailers, corner stores were selling them, were selling single cigars too. And when you looked at this juxtaposition with the adult perception, there was a big gap. So adults, as I mentioned before, really did not see this as a youth problem at all, that these were affluent, expensive cigar sales, reserved and primarily associated for older men. And many were and still are really unaware of the fruit and candy flavors and attractive packaging. So we had this information, and we had to decide what we wanted to do with this. So we certainly wanted to celebrate our success in cigarette smoking, but raise the awareness of the problems we were seeing with cigars. And at the time, we had received an application from the federal government for American Recovery and Reinvestment Act stimulus funding for tobacco control, for hard-hitting media campaigns on tobacco. And we thought that this was really a perfect opportunity. This had, as far as we knew, really not been done across the country before. Delaware had done a little bit of a campaign, and Massachusetts had done some work on cigars, and we spoke with both of them. But Maryland was really, really a pionear in this area, so we wanted to develop a campaign addressing this here in Maryland, and because we saw this was also a national trend. And we wanted to work with our youth coalitions, the trash members that I mentioned, and our community partners to spread this message. So we struggled a little with what our target was going to be. It wasn't a lot of funding that we received, and whereas we wanted to blanket the state with this message, we really had to be more strategic. So we thought about, number one, who would really care about this issue? And we thought mostly parents of children who were of the age smoking these cigars would be our main advocates, and other active community members. And we also wanted to be really careful, whereas we wanted to do youth prevention, to not have an unintended consequence of going out there and saying, hey, these are attractive, they're in flavors, they're affordable, they're accessible, and encouraging youth to smoke them and raising the awareness in the opposite way among youth. And our message is we really wanted to overcome these misperceptions that cigars are not a safer product than cigarettes. They have the same toxins as cigarettes. They're just as addictive, and certainly that youth are using these products. And as I said, our theme was really attractive, accessible, and affordable. And they're available in chocolate, vanilla, strawberry, same flavors as candy or ice cream, and really youth could go into these stores or even an ice cream truck and get them for the same price as a candy bar or an ice cream cone. And the sweet flavors mask the harshness of tobacco. So we had talked about, and Dr. Josh Sharfstein, who was the former Deputy Commissioner of FDA, we're now fortunate to have as our State Secretary of Health, and we had a conversation about this and how these sweet flavors really trap kids into a lifelong addiction, and it's a seemingly harmless product, and we kind of ran with that trap theme. So we did some informal pre-testing around the health department. We had received several creative concepts from our ad agency, and we wanted to narrow it down a little bit before we did focus groups. We were also fortunate to have CDC, Legacy Foundation, Campaign for Tobacco-Free Kids, look at our materials. And the FDA Center for Tobacco Products was really just getting up and running, so we were able to get some feedback from them, which was great. And this feedback really helped us drive our further testing. And one of the things we kept hearing, well, what's your target and what's really your call to action? So we really wanted to narrow that down, because we do know that there are certainly effective policy initiatives to address this, but since this was federal stimulus funding, we had to be very careful, certainly not lobby. So we wanted to educate and get the message across. So this was the first concept. We ended up testing 4 concepts in the focus groups. And this was a little bit of sugar makes the poison go down, and we liked this, and this had the cigar juxtaposed against the candy to show the flavoring. There was a little concern that this might be a little too attractive. The second one was, psst, want to smoke some candy. So this was a little more darker, ominous, predatory message, the industry kind of luring these children into a trap. This was another variation on a little bit of sugar makes the poison go down. People weren't as excited about this one, but it did have the skull and crossbones on the little label on the cigar. And finally, no matter how they're sugar-coated, cigars kill, which was kind of what we talked about, the ice cream truck and sort of like the Pied Piper effect. We also tested several taglines. Make tobacco childproof was one we initially really liked, but there were some concerns over, well, we don't want to just have make tobacco childproof and just focus on children, because this is a broader issue, and tobacco technically is already illegal for children to smoke. So what kind of message does that give? Or what kind of response would that receive? Protect our children. Again, that was the limiting to children, but also, well, what's the cause of action? What do you want? Call to action, what do you want people to do? Want to smoke some candy? That went along with the more predatory message. a little bit of sugar makes the poison go down. We liked that. And no matter how they're sugar-coated, cigars kill. And we liked that one as well. So we then did focus groups, again, targeting parents, mix of gender, racial and ethnic backgrounds. We did all non-smokers, and we did want the focus group participants to have some kind of civic involvement in their communities. And the goals, in addition to testing the creative, we really wanted to find what the awareness was of these products. Did they know about these products, and did they know that youth were smoking these products? We also wanted to see about social media usage. Our ad agency initially just wanted to do a Facebook page and not a website, and we wanted to see if that was the best avenue to target people. And we also did some Google search engine ads, so we tested some of those. So the reactions to the products, this was very interesting. These were some of the products we showed, but we did not initially take them out. So we just had the facilitator ask the individuals about their knowledge about cigars, and some were generally aware of the products. Someone said, "Oh, black and mild, yeah, I've heard of those. I've seen those with the white tip," but didn't know much more. And then when we put these out on the table, along with one that I don't have here, which was a pink sparkly wrapper with a pink berry cigar in it, they really were visibly shocked. They had no idea that these products were coming in these flavorful flavors and colorful packaging. And here were some of the quotes from the participants. "My first impression when I looked at the packages is that they don't look like cigar packages. They almost look like candy." And that's not an accident. "It's like picking up a pack of gum. It's going to catch your eye. And it doesn't even smell like a cigar. You're not exactly sure what you're buying." The reactions to the creative, we found that participants definitely wanted a direct message. They wanted something that was clear, that said youth are being targeted, these are harmful, these are the same ingredients that are in cigarettes or in cigars. And they did prefer an official website versus having to go in through a social media outlet. So this was the winning creative, the one with the ice cream truck. And again, some of the quotes from the focus groups were, "I love the graphics in it. I think it gets to the point. It's kind of exciting to follow it and then read below to see what point they're making. If I was reading this in a magazine, I'd rip it out and take it home." Another one was, "It brings home the fact that access to cigars is as easy as the ice cream truck. For a lot of kids, it's easy to get, and it's something that you, as a parent, should worry about." So we really thought that this had the best reaction from the participants, and we made a few minor changes on it. We made it a little darker. This was the resulting ad, and we kind of pulled out the warning. So the warning here was smaller on the bottom, but we wanted it to kind of be reminiscent of a cigarette pack. And we changed it from, instead of "no matter how their sugar-coated cigars kill" to "no matter how they sugar-coated cigars kill." So it kind of had a double entendre. So the industry, no matter how they try to make these look innocent and attractive and flavorful, they're still the same products, cigars kill, and then also sugar-coated the flavors. And we changed the tagline to bring in that "it's a trap," and this is when we came up with the whole cigar trap title. "Cigars in any flavor are as addictive and toxic as cigarettes." And we listed out the ingredients, that they have cyanide, nicotine, arsenic, and a few more facts on the bottom. So we took this creative, we developed a website, we developed posters, ad campaigns. Unfortunately, we didn't have funding for TV, but we used this theme in radio ads and transit ads and billboards. And we also did, for those of you who could see this, an informational packet, which is just a glossy two-pocket folder that had fact sheets in it that if you get in touch with me, we're happy to distribute to you. We're actually reprinting them right now. And it started with a letter from Dr. Sharfstein, from the Secretary of Health in the beginning, and then has a series of fact sheets. So it could be used as a packet as a whole, or individuals could take out individual fact sheets and disseminate them as they wish. So here are some of the fact sheets. So it's a trap. This was kind of an overview to what we were doing. This has some of the data I showed you at the beginning. Here, what is a cigar? And Dr. DiClemente is going to talk about this a little more, but the difference between the large premium cigars, the small cigars and cigarillos, and then little cigars, which I haven't talked about much, which is like a brown cigarette. more cigar use in Maryland, how these are sold, the flavors, the packaging, and disturbing facts. And then we wanted to offer some resources and things for folks to do. So we had a scope, an overview of the problem, the solution, and again, we were very careful here. We wanted to stress these are expert recommendations to reduce youth cigar use. This is not what we, the Department of Health, are saying should be done, but these are evidence-based methods. So to prohibit the sale of flavors in these products, to ban the sale of singles and require minimum packaging, to raise the tax, and certainly to support comprehensive tobacco control programming. And what can I do? So we wanted individuals, first of all, to know what's going on in their community. Go to your corner store, find out where these are being sold, who's purchasing them, how much they are, to do this environmental scan and surveys, and certainly share the information with decision makers and others in your communities. And then additional resources and partners. We created a website, which, yeah, I know, I don't want to. There. Okay, so this website, thecigartrap.com, does have all the same information that's found in the packets. And let me get this back up. All right, this is why I wasn't going to do it. Get back to the slideshow.
At the bottom, Dawn, you can just click on one of those. Oh, you're over there. Yep.
Yeah, it's not. I know I'm changing colors. Sorry. Okay, thank you, whoever did that. No. No, it's not on the bottom. Okay, there we go. Okay, success. And we also have a Facebook page. So I encourage everybody to like us on Facebook. We are still doing updates here. So we thought about, so we have this campaign, and what's the best way to launch this and promote this? And we thought last year, so as we were told during the introduction, November is the Great American Smokeout. And last year, we had not released this 2010 Youth Tobacco Survey data yet. And we thought this was a perfect opportunity both to highlight our successes and show where we were going with this. So on the day of the Great American Smokeout last year, we selected a high school in Baltimore City, which was great. This was where some of our Trash Coalition members were, and they were able to get up and talk about, this is the problem in my school and with my peers and what I see. And Dr. Sharfstein came along with the Baltimore City Health Commissioner, and we released our data and also launched this campaign. And we received a lot of really good press. All the local TV stations ran it on the news that night. We had an article in the Baltimore Sun, Teenagers Trading in Cigarettes for Flavored Cigars. Our national partners at Tobacco Free Kids and the American Legacy Foundation did national press releases. And after a series of interviews over the next few weeks, the Washington Post ran a front page article called Teens Swapping Cigarettes for Flavored Minis. Teen swapping cigarettes, for flavored mini cigars. So we were really pleased with the coverage on this. And the placement was actually pretty small. We did for about a month before and after New Year's, transit and radio, and then we were able to leverage additional funds for our Center for Cancer Control and air some of them again in the spring. And it was pretty widespread, transit and billboard. We also had some added value for radio. We had several radio interviews, and Dr. Sharfstein actually did an interview in Spanish on a Spanish radio station, which was pretty impressive, and web banner ads and things like that. So here are some of the actual ads. You can see the top center and the bottom right. So these were kind of small local billboards, and then larger billboards we had along I-83 and Interstate 95. The middle and the one below that were some bus ads. The top right and the bottom left. These were transit ads, so kiosks and metro stations and bus stations, and also I think the bottom left was on the MARC train, so that's a major commuter train in between Baltimore and Washington. And the top left, this one was interesting. Ocean City, which is a major beach destination in Maryland, has this tram, this shuttle, free shuttle that runs up and down the boardwalk, and to take people from one end to the other. And they sold advertising space on the top this past summer, so all the high-rises that line the boardwalk who look out can see these ads on the top. So we thought that was kind of interesting. We actually used this for our Maryland Tobacco Quit line last year too. And we had a success. So again, I will not directly attribute this to our campaign and our educational efforts, but the Maryland General Assembly this past spring did pass a tax on cigar products to make them equivalent to the tax on cigarettes. And one of our partners had actually gone into a corner store or a gas station and saw this sign. So I guess there had been some feedback about the increased cigar prices. And Tobacco Free Kids had put together just kind of the estimated price increase here from the tax, and hopefully youth cigar use is expected to drop by about 30% because of this price increase. So that's a really good start. But we are continuing this campaign. The stimulus funding has terminated, but we're revamping the focus on our materials. We're reprinting those now a little bit to focus more on flavors since the tax passed on price. We're continuing, as I said, our Facebook updates and distribution. And we also were fortunate in Maryland to get a community transformation grant. And one of the key tobacco issues in the community transformation grant, which is dealing with the 19 counties in Maryland, is this cigar issue. And we've partnered with Dr. DiClemente at MDQUIT at UMBC and others to supply county-level data to work with these local health departments and provide materials and expand and increase this campaign outreach. So I am going to turn it over to Dr. DiClemente. I think we're taking questions at the end, and here's my contact information.
Great, thanks, Dawn. Put that down and then end the show and get mine. So, yes, we're, I want to just say a couple of words first. I was very glad to be here. I direct what's called the MDQUIT Resource Center, which is the resource center funded by the Department of Health and Mental Hygiene here in Maryland to actually be a resource center for professionals in terms of promoting use of best practices, in terms of training and helping people to understand the issues that are there for tobacco control in the state. So we've been in existence since 2006. We also really try to help the quit line. So what we're trying to do is to get professionals and health departments, local health departments, to really promote smoking cessation in their areas, smoking prevention. We have a best practices conference. We do a number of things. We reach out and go out to the local health departments to try and kind of empower them to become more equipped to do best practices, both whether those are prevention or cessation kinds of related. So as part of that, we became partners and continue to be partners. We also have another partner who is integral to the work that we're doing that I'm going to explain to you today, which is the Legal Resource Center. There is a Legal Resource Center for Tobacco Control here at the School of Law, and we at the University of Maryland, and so we actually partner with them as well to kind of build some synergy between kind of understanding the policy dimensions and then trying to kind of understand also the research and how that research impacts some of the messaging that we're trying to get across. So that's the kinds of things that we're doing. Dawn mentioned the Community Transformation Grant. That was awarded from CDC There were a number of partners. It is really focusing on the smaller counties, so it doesn't really kind of focus on it excludes the 5 largest counties in Maryland and really focuses on the smaller counties to try and make sure that we're reaching out and getting the information to them. It focuses on tobacco-free living, active living, healthy eating, and control of hypertension and high cholesterol in these 17 smaller counties. There are a number of smaller projects that are part of that. Actually, Johns Hopkins has one of those projects, the Healthy Stores Project, which is part of the Community Transformation Grant. And the idea is to try and kind of get these partners to kind of help and build some synergy, both bring the academic and the local professional, the DHMH folks, the local health department folks, and the local community, because most communities do have kind of community groups around tobacco and health. So we bring those folks together and are trying to help them with these different projects to create these outcomes. So as part of that, we've been working together, especially our focus has been especially on tobacco. So we've created a program to go out into the local communities and try and help them understand how to reduce smoking among youth and adults. The Legal Resource Center talks a little bit about smoke-free multi-unit housing. We talk about smoke-free outdoor areas. And then the main focus of a lot of this has been on youth cigar use awareness. So we've been working together to do that. So what we're trying to do with the tobacco use among youth is to educate the departments and other prevention professionals using data from the Maryland Youth Tobacco Survey. So the one thing that has been helpful, the Maryland Youth Tobacco Survey has been done from 2000 to 2010. It's been done 5 different times. And so we get that data and we look at that data and use that data to try and empower the locals and the state to try and look at what's happening not only in prevalence, but we also actually create the staging data. So we actually can talk to you about the stages of initiation in tobacco for every county and across the state, and we can talk about the stages of cessation with the adult tobacco survey. But the youth tobacco survey is particularly rich in terms of looking at that. And as Dawn showed already, we have a significant decrease in smoking rates with both middle and high school youths. So in middle school, actually, there's a 52% reduction from 7% in 2000 to 3.5% in 2010. So that's really a significant change over a 10-year period. And I think the state and the local folks really need to take some credit for the work that they've been doing. There also is a change in the culture, as you know, and a change in the way that we see smoking. So that's really affecting our youth, which is great. We also have about a 39% decrease for high school youth. So we went from 23% in 2000 to about 14% here in 2010. Now this is prevalence rates, okay, so that's past 30-day smoking. What we've also been doing with some of this data, because the last couple of years we're getting data around alcohol and marijuana use. And what you will see, what's interesting is that smoking cigarettes is very strongly associated with both alcohol use, binge drinking, and marijuana use. And that's something that we've been trying to kind of talk to the locals and talk to the professionals in the area to help them understand that when you're doing tobacco prevention, you may also be doing drug abuse prevention in a lot of ways. The other thing I want to mention before we go on to the cigars is, it's been really interesting to me. When I first got in this field a number of years ago, we won't go back that far, but it was cigarettes. People smoked cigarettes. They smoked at least a pack usually. Average for all of our studies, when we would get a group of people in any study, the average number of cigarettes was around 20 per pack. Currently, if you're looking at trying to get people in and for studies and whatever, the average number of cigarettes is about 10 to 15. So the average number of cigarettes in general for smokers has gone down. there's a change in the habit. Our prohibitions and our policies change the way people see things and what they do. So we also have found, we just finished a study looking at some college students, there's a lot more non-daily smoking. You found very few non-daily smokers 20 or 30 years ago, whereas now you find about half of the sample of college smokers were non-daily smokers. So people are learning how to smoke around kind of the bans in some ways, and so we have to be careful about that and look at that. One of the other things is everybody smoked cigarettes. I mean, there were pipes, and there were always cigars. But the cigars were kind of the big cigars that people smoked, the Cuban cigars when you could get them, or when you still can get them, but you have to get them on the black market. But you can still get Cuban cigars. So those big cigars were really kind of old men and cigars, very few women, very few kids. Nobody really smoked cigars. Then the tobacco companies kind of changed their strategies and included more cigars and made the cigars smaller and more like cigarettes. So in fact, I mean, actually my brother quit smoking cigarettes, but always had a little packet of cigarillos that he would smoke periodically as his way to kind of quit. So it was interesting. People were kind of shifting to cigars. Even some of the adults were shifting as they were quitting smoking. As the tobacco and the cigarette smoking kind of got more and more pressured by culture and by laws and by restrictions, the tobacco companies went into more and more cigars. So the idea is, and it's interesting if you look at that, what's the difference? We asked locals, what's the difference between these two things? Are both of these, are these cigarettes? And everyone would say, well, they look exactly like cigarettes. But if you have tobacco in the wrapper, they aren't. They're considered cigars. And so that's how you can make a little cigar that looks very much like a cigarette. And they're packaged the same way, they're sold the same way. Sometimes they're sold as loosies, but basically those cigars look very similar. And now we have a lot of different kinds of cigars. So you have the little cigars, you have the cigarillos that are tipped, you have the cigarillos that are not tipped, and then you have your more traditional cigars. And what's interesting is the people who sell the more traditional cigars aren't really that interested in selling the little cigars. So it's an interesting kind of piece. So let's look a little bit more at this data that Dawn showed you a little bit of, but we can look at that. About 1 in 4 youth report any tobacco use. So again, what we're thinking about, you got to think more broadly about tobacco use, because that includes cigarettes, cigars, BDs, Kretex, pipes, smokeless tobacco, hookah. So we have different ways of getting our tobacco and getting the nicotine into the system these days than we did a number of years ago. Dawn already showed you this, but I think what's interesting is if you look at it, the change seemed to happen around 2006, right? And between 2006 and 2008 is when we had the Clean Indoor Air Act. And so basically what you see is that it's possible that people, and we also had in 2007 an increase in taxes for cigarettes. So when you put the tax increase and the prohibitions around, what you see is that youth anyway seem to have kind of moved and kind of found little cigars and cigars as a better and a different kind of way of getting nicotine. And you see that increase. So it is interesting to see. It's also interesting to see what they're using. So 1 in 5 youth who use tobacco report smoking just cigars. So that's a difference. But you see that there's a lot of kind of overlap here. Cigarettes is 21%. Now these are of the kids who are reporting tobacco use. 21% cigarettes only, 18% cigars only, other tobacco use, including all of these kind of smokeless pipes, about 16%. And then you have cigarettes and other, cigars and cigarettes is about 17%. Cigars and other tobacco use is about 6%. So a lot of these kids, once they get into the habit of using the tobacco, also get to use, are using a variety of these products that are out there. Dawn showed you this, but this is the array of candy and liquor flavors. So you actually have cognac cigars. So they have a cognac flavor. So it's interesting to kind of see. And as Dawn mentioned, there is a loophole. Cigarette has banned flavored cigarettes. So, included a bunch of flavors, everything but menthol. So the FDA has not banned menthol. You can still have menthol cigarettes. So what happens to loopholes are people kind of do things. This is Rita's in the audience here, so I want to kind of give her credit for her slide here on the wraps. These aren't even really cigars. These are wraps that you could use, tobacco wraps that you can wrap other things in, and you can imagine whatever other things you could wrap in there to use. Just use your own imagination and you could do that. And then on the right there are more like the cigars. Why add flavors? Well, it works. Over 3/4 of the kids report using flavored cigars. Typically, those are like cigarillos, but they can be little cigars. They're attractive, and we went over some of that. Hispanics seem to have the highest percentage here in 2010. Hispanic youth prevalence of use was 17%, African American 15%, and white youth was about 12%. As Dawn said, however, girls, it's a little bit different if you look at that. When you look at this use for the current smokers and you compare current smokers and non-smokers and look at alcohol use past 30 days, what you see is about 80% of these kids who smoke are also drinking. The same is true for the cigar smokers. Cigar smokers is 77%, 78%. If you look at marijuana use, you find the same discrepancy. Cigarette smokers, 70% of them are also reporting marijuana use, as opposed to about 13% of the non-smokers. So obviously these kids are risk takers. The smokers are part of that group that's kind of beginning and doing a lot of things. And with cigar smokers, 74%. Now that's even higher because, as you know, sometimes cigars are a transport vehicle to transport marijuana into the system. So that's the way that goes. The other thing, what we've been doing is trying to use this data to go into the locals. So, problems are national and statewide. Solutions are often local. And so if we're going to try and go in, you have to convince the locals that this is their problem. It's not just a problem of the state or Baltimore City or whatever. And what's been really interesting is when you go into the locals, they are very interested in learning about their particular county. So we've been going around the state having different meetings, so regional meetings, meeting with 2 or 3, or at this case we did 5 counties at the same time and trying to kind of talk with them. We're grouping them so that they have some similarities and commonalities. And then we show them what their rates are based on the data from the 2010, and these are survey. So any tobacco products is the tallest bar across all of those, but you see it differs. I mean, Kent County has about 24%. There's only 17% tobacco use statewide, but most of these counties are higher than that, and there's about 20% here in Queen Anne as opposed to 24% here. Then you look at cigarettes. The cigarettes are the next bar down, and you see that there's some difference, but relatively similar, around 15%. Then you can see about the cigars is the next bar down, and the smokeless tobacco. And you'll see that there's big differences in smokeless tobacco use. Cigar use, there's also differences. Kent, that has the largest, also has the largest levels, percentages of kids using cigars. And so this data is kind of then presented to them and given to them not only overall, but also by county. We're also trying to give them, this is alcohol. So no matter what county you're in, the smokers are also drinking. This is the marijuana use. oh no, this is current use of cigarettes, cigars, and smokeless tobacco products in underage youth. So we show them that across the state over the 10-year period. You see cigarettes going down, you see cigars going up. Smokeless tobacco stays pretty much the same. And then we show them again the connections between all of these kind of things. This is the marijuana use among the current smokers by cigarettes, cigars, and smokeless tobacco. And you see across all of those, this is statewide, but this is for the individual counties, you see that it's 70% of the kids who are smoking cigars are also smoking marijuana. And that's in all of these smaller counties. So what we've done then is create for them these individual packets of information. So this is the page. So Caroline County, we give them their specific county information over the 10 years. And I'll show you that these come out. So this is Caroline County's use of cigarettes and cigars over the 10 years. We give them their statewide. We let them compare it to statewide cigar rates and cigarette rates. We give them a little bit of a summary, and then we give them some suggestions about what they can do. So we try to summarize for them what's happened to their, so they can use that in talking to their local executive and local council and health department folks. Kent County, same thing. So we do these for each of these counties. We give them their own specific information. Then we try to get them to understand, do a little bit more of cigar awareness and prevention and focus a little more on counter marketing. They are very impressed with this number, as you should be also. Among all U.S. manufacturers, the tobacco industry is one of the most intense in marketing its products. Okay, they spend $10.5 billion a year, $29 million a day. So when we talk about people really, then we kind of make a joke. If I only had one day of their advertising budget, we could actually do a good bit in here. Only the automobile industry markets more fiercely than the tobacco industry. And you see, the marketing is there. You see pictures of youth. This is Captain Black little cigars in a box of cherries. So life is a bowl of cherries, but actually Captain Black is right in the middle of them. They're cheap, sold cheaply. They're packaged and colors very similar to Skittles. They make them appear fun and harmless. So I'm doing this slide presentation at home. I'm organizing my slides, and my daughter Anna comes in behind me, and she's looking. She said, "What are you doing?" I'm doing this presentation on cigars. She goes, she's a sophomore at Susquehanna University. She goes, "Oh yeah, we have a lot of cigars outside there. People don't think they're that harmful." So these are college students. So the message is out there that if they're this nice, they got to be harmless. They can't be really there. There's also a lot of marketing, and you'll see this. There's magazines. There's other kind of things. Here's all of those. I mean, even Snoop Dogg is doing executive branch cigarillos ads. So who is that? That's not marketed to you or to me. Well, maybe somebody out in the audience there who I didn't know. But cigar-friendly magazines. There's the Cigar Aficionado. The one on the right actually is a joke. I mean, we put Justin Bieber in there. But basically, it's just as good to kind of have those things. You see everybody and their sister smoking cigars. So the advertising to women is certainly there. Placement of these ads, doing all of these, it's very highly visible. Depiction in movies, lots of people are smoking cigars. It's macho, it's even sexy if Angela Jolie does it. So it's really interesting to kind of see. The same thing is happening with these other tobacco products like smokeless tobacco. They're obviously also in flavors. They're kind of, the NASCAR thing, selling them. The smokeless tobacco marketing doubled between 2005 and 2008, from 250 million to 547 or 548 million from tobacco-free kids. So there definitely, we aren't in a zero-sum game. So when you think about this, if you think about stages of initiation, these are the things that are both promote explicit decisional balance as well as implicit kinds of things, messaging about, hey, this isn't that bad, these aren't that bad, you don't have to really worry about cigars. Those cigarettes are really bad, but you don't have to worry about the cigars. The other thing that's happening is placement in the stores. So these cigars aren't really sold in cigar bars and big shops like that. They're sold in the corner stores. They're sold in the gasoline stations. They're there at the counter. There's data that shows that teens shop at retailers that teens shop at the most have been shown to contain more point-of-purchase advertising. Okay, so it's really there. One survey found 50% of retailers had tobacco ads at 3 foot or lower. So eye level or lower for who? Not for me, for kids. 23% had tobacco products within 6 inches of candy. So what we're trying to get the locals to do is to think about their local stores and see if they can actually make a difference in terms of talking to those folks. Interesting thing here, one study of middle school students concluded that youth who visited a convenience, liquor store, small grocery store at least weekly, more exposed to tobacco advertising, had a 50% greater odds of smoking. That's like having a parent who smoked. So that's a really interesting piece. And finally, what we try to do is give them some of the recommendations from CDC about program activities to reduce cigar, smokeless, and other tobacco use. So we talk about counter advertising. We talk about comprehensive school-based tobacco use policies and programs. And it's really important that you understand that most of our prevention activities are in middle school. Most of our adoption is in high school. So we have a mismatch of what we're doing in the different places. The messaging in the high schools has got to be increased and made stronger. Community interventions that reduce tobacco advertising and commercial availability, and then higher costs for tobacco products, as Dawn pointed out, is another possibility. So that's the kind of scope of what we're trying to do in terms of bringing data, information, best practices into the local communities, supporting the cigar trap. So basically we bring that with us and show people that they can get these materials. We bring Dana or Dawn or somebody with us to talk about that. And they are then kind of empowered to kind of go into their local communities and do something about this problem. Thank you. Good, so I think we're moving to the question discussion period. I'm going to go back to my chair.
While I'm coming up, could you define what a cigar is legally versus a cigarette? I just asked what the difference legally is between a cigarette and a cigar.
So we have our legal representation here in the audience, but basically anything that has any tobacco in the wrapper is classified as a cigar as opposed to a cigarette, and there's no legal technical amount of tobacco.
What does that mean in the wrapper?
So the paper. So the cigarettes come in a white paper wrapper. The little cigars, as Carlo mentioned, are brown. So as long as they put a little bit of tobacco in
The wrapper.
Whatever the wrapping is,
so
it's classified as a cigar.
So a cigarette is a cigar?
No.
Yeah, so a cigarette is just wrapped in white paper.
Right. So cigarettes actually are wrapped in paper that have no cigar content at all, or cigarette or nicotine or tobacco content at all. Okay.
The tube that the cigarette is in, the tobacco.
Right. So originally cigars were tobacco wrapped in tobacco and smoked like that. So that's how they got that definition, was anything that's wrapped with tobacco ends up being a cigar. So to get into the loophole, if you put tobacco into the wrapper for the little cigarette as opposed to just using paper, you get away with calling it a little cigar and not a cigarette.
So there's tobacco pulp in the paper pulp that's used to make
Right.
the wrapper.
I'm not sure you heard that. There's tobacco pulp in the paper pulp to make the wrapper. So that's how they actually get away with that's the loophole.
Got it. I knew there had to be one. I just didn't know what
Yeah.
it was. For all of you online, please feel free to submit questions to maphtc@jhsph.edu, and I'll open it up to the in-person audience, and we have a number of questions from our online audience already. Please.
On a couple of occasions, you sort of equated the use of little cigars or cigars in general with the amount of sugar in them, making the poison go down and so forth. Is there any data out about how much sugar are in various cigar products, and is there any correlation between the amount of sugar and the appeal to youth?
That is actually something we've started to look at, and we've been in touch with CDC and some other researchers at universities to try to look into that issue. We haven't seen a lot of data out there on that yet.
And to build on that, one of our online audience members is asking, what do you see in other states? What's going on in other states in terms of use and then in terms of interventions?
As I mentioned, this is among the first cigar campaigns that we put together here in Maryland. Delaware and Massachusetts have done campaigns focusing on cigars and other tobacco products, some that Carlo showed before. But we are seeing cigar use increasing among other youth in other states as well. So we hope that campaigns such as this will be replicated. We've received a lot of attention nationally and from other state health departments on what we've been doing, and the awareness is certainly being raised.
Do you have any reason to think that what you're seeing in Maryland would be different in other states?
Not really. I think that it's happening across. I mean, there are a couple. I mean, California has a lot more regulations, and some have actually put in regulations around little cigars. So some states have done that, and some local jurisdictions have done that. So in those places, I would imagine there might be some differences that you would see. But otherwise, I mean, it's a national marketing campaign for the tobacco industry.
Someone in the audience asks us that you had said that the cigarette industry, or the tobacco industry, was spending $29 million a day based on CDC data of 2000. It's now 12 years later. We have had tobacco settlements since then. Do you have any reason to think that the amount they're spending is different?
No, actually, the spending has, since the tobacco settlement, the spending has increased dramatically. So basically, they realize that it becomes a tougher, because there's been so much restriction on what they can do for advertising, that I have seen a chart that looked at tobacco advertising has gone up, I think the chart went to 2008, has increased every year in terms of the total cost. So no, they've actually changed their marketing strategies, are using different kinds of venues and different ways to kind of reach them, because remember we told them they can't do it in certain magazines and in any magazine that are that are youth directed and other kinds of restrictions. So they've actually moved into different marketing venues.
Okay, our next guest asks, they understand why we have such an anti-cigarette campaign, but why is this cigar or this anti-cigar movement so lagging so far behind?
I think really when you look at the data, that cigar use 10 years ago was much, much lower. And we've seen the increase, and our prevention efforts starting in 2000. We always talked about all tobacco products and smokeless tobacco and cigars, but the push was really on cigarette smoking. And since there have been so many more controls around cigarette smoking, which has lowered the prevalence, we've seen the cigar rates increase, and that's why we're targeting that now.
Yeah, I think, I think smokeless has always been in the picture. So there have been aggressive smokeless campaigns in certain areas, because smokeless actually, in our counties, for example, in Maryland, smokeless is much more of a problem in the western counties. That's really where you see the huge amount of smokeless tobacco, and we've gone out there to try and work with them on the smokeless piece. What I think has happened, as I said, I think in there, as the tobacco, as the cigarettes have kind of gone down, what you see is that the cigars have not followed. It's not that products are kind of going down together. Products are changing in terms of their appeal. And they are changing the products in terms of their appeal. So I think that the cigars have become much more important as an alternative to cigarette smoking, whereas before it wasn't. There were people who, like I said, smoked cigars, but that wasn't as big an issue, especially with youth. The fact that it's becoming a big issue with youth makes it a really very significant and salient problem right now.
Cigarettes used to be much cheaper. They were sold individually. Right. Flavors in cigarettes were only banned by the FDA in 2009. So there's been that shift.
That shift as well.
Please.
Hi, thank you for the talk. Just a quick question. Being involved in clinical research on the ground, talking with people who actively use cigars, we've noticed there's a problem in identification. People who are using these products don't necessarily identify themselves as smokers. Mm-hmm. And I'm just wondering if you could talk a little bit about some of the things that you have seen at the state level. Are you noticing an identification problem as well? If you're asking them, do they regularly smoke? Are they queuing in the same way because they may or may not identify?
Yeah, we are finding that. And several years ago, we did change or add questions in our survey. Instead of just asking, are you a smoker or do you consider yourself a smoker? And then asking, what is your smoking history? So we did see kind of a difference between people who said, yes, I'm a smoker, no, I'm not a smoker, but they had smoked in the last 60 days or 6 months. And there was also an issue in the survey data as far as what is the definition of a cigar, which was the first thing that came up here. So when we asked, are you smoking cigars, if they were smoking these brown cigarettes, often they would say no. So we're really trying to clarify the questions and ask additional questions so we can drill down to that.
Yeah, the MYTS has a lot of individual questions. They ask questions about Cretex and BDs, but they say very specifically what you're asking about. So even in the cigars, they actually mention the kind of different kinds of cigars. So they don't ask about being a smoker. But I think you're right. We're doing a lot of screening now also. So docs are supposed to be asking about whether you smoke. So you have to really be careful if you're going to kind of do that now, because you almost have to ask, have you had a cigarette in the last 30 days? Because also the people who don't smoke daily do not consider themselves smokers. So we found that. They will kind of say, no, I'm not a smoker. A smoker is a person who smokes every day. And if you don't do that, then you don't think of yourself as a smoker. So you have to be really specific about what you're asking. And even when you ask about cigars, you need to ask, whether they use the cigar as a transport for the marijuana a lot of times. Because that's, when we asked about kids in Baltimore a number of years ago about, how many people smoke around you? And they go, well, what do you mean? Which thing? What smoke? What? Which thing are you talking about? So you have to really be careful, I think, these days in asking that. You can't just say, "Are you a smoker?"
Along those lines of marijuana, first, I assume you were showing us smokers who use marijuana, not marijuana users who also smoke.
No, we were looking at the smokers who use marijuana. We're looking at smoking first.
Okay.
The other is also high. The marijuana users also, a larger percentage of marijuana users smoke than don't smoke.
Which would make sense to me anyway, intuitively. Along those lines, one of our listeners asks, as states are liberalizing marijuana use, how do you think that that may affect the use of these products?
I knew if we opened the question to marijuana, somebody would be into the legalization issue as soon as we kind of dealt with it. Well, I think that's an interesting question. We're actually trying to put together a grant to kind of take a look at some of the things of what's happened, and then so we're able to look at what would happen in the future. I mean, clearly, what happens is the legalization, even the medical marijuana legalization, changes the perception, so that this drug is now perceived as less problematic. So we're training docs down at the University of Maryland to do screening and brief interventions. And as you go in there, the docs are really do not want to ask about marijuana. Because as soon as they ask that, the patients will go, well, wait a minute, it's medical marijuana. I mean, if you can use it medicinally, you can use marijuana. I mean, it's not a problem, right? Because have you used drugs? They say no. Do you smoke marijuana? Yes. So the perception is different, and I think the legalization will change the perception. Now, how that impacts the smoking marijuana connection is interesting, because it's still illegal for kids. So we're talking underage. So it's not that this would be illegal for any of them to do. So legalization is not going to change that. It's going to still be 18, 21, whatever the age is, even if you legalize it. So these kids are still going to we're using underage 17 and below kind of age ranges when we present our data, because that's the ones that I think makes the most sense. So it still will be illegal, but the question will be how it will affect the perceptions.
Actually, somebody just a few floors up from us is asking, do you have any plans to develop campaigns that target youth and adolescents directly? And then what do you think will be the relationship between the anti-cigar community and the legislators? Will it take as long and be as hard a fight at each step of the way?
We'd certainly like to develop campaigns directed at youth prevention. Funding is always an issue, but we would like to further these efforts. And as far as the legislative aspect, I don't want to speak too much on that, but certainly we were able to see a passage of a tobacco tax on these little cigars last session, which happened pretty quickly. And I think the issue is simply one of parity. So when we're looking at here are the controls on cigarettes, the ban on flavors and the minimum packaging size, where's the parity with cigars? And they're both tobacco products, and they're both as harmful, and there should be equality there.
Somebody else, actually, two different people have asked the same question in different ways. Is someone at the federal level taking the lead on these kinds of activities, and or have any states thought of working together to raise the minimal support, minimal financial support you have now?
Well, certainly FDA Center for Tobacco Products is acutely aware of this issue and has heard from state health departments and individuals and national organizations. So they're looking very closely at the cigar issue, since, as I just said, the FDA has regulations on cigarettes, so why aren't there the comparable regulations on cigars? And we also have been talking closely with CDC and other national organizations about talking about what we've done and how we could work with other states, or if they can provide. CDC does provide tobacco control funding to every state, and there's quite a bit of leeway on how states can use that funding.
I mean, the struggle is really, the FDA is currently struggling. I mean, they could move to kind of take more control of the cigars, but they're obviously having struggles with what they've been doing with ads, and there's a strong lobby. So the likelihood of really moving into getting some national legislation is probably what you would need, and that's harder to do, I think. And FDA kind of is working at it and struggling with it, but obviously they've got a lot of things on their plate right now.
Any other questions, please?
Just going back to the advertisement campaign or the counter-advertisement, it looks as if really cigars and maybe rolling around cigarettes or other alternative tobacco means are becoming more popular as cigarette use declines, wouldn't it be better to formulate a counter-advertising campaign that centers more on tobacco rather than on specific types of products, so that all tobacco products are bad, rather than just a single campaigns that look at cigarettes or cigars?
Yeah, and certainly that is the message we want to get across, that no matter what form of tobacco you're using, smoking or smokeless tobacco, that it's harmful. Often we find that we need to kind of designate the products, so whether it's youth or adults, they know exactly what we're talking about. But yes, and when we promote our Maryland Tobacco Quit line, which is 1-800-QUIT now, we certainly talk about all tobacco products and not just cigarette smoking, and we're not just targeting cigarette smokers there.
You know, it seems like from the data that you show that there is a difference in risk perception now. I mean, whether
Absolutely.
or not that message is getting through or not, but people seem to think that some tobacco products are less health risky than others.
Well, and it's, I mean, the problem, Wally, is that we have some, I mean, nicotine is the tobacco byproduct that's the active ingredient, as you know. The real issue is that there's a lot of ways to deliver nicotine. And so I mean, we now have the electronic cigarette, okay, which is touted as being less harmful. Actually, there's lots of ads. Go on and Google some of those ads, blogs of people who are really kind of touting this as this is a safe alternative to smoking. There's NRT, so you have to really be careful because you don't want to kind of say that smokers shouldn't use NRT to kind of get off, so or help them to get off. So nicotine replacement therapies. Those aren't really tobacco products as we kind of talk about them, but they are the byproduct of tobacco. So we sometimes have to be careful, I think, about looking at that. We don't want people not to use some of the aids that they have or reduce harm. So that's been the argument sometimes about kind of trying to kind of say, oh, all nicotine, all tobacco, everything is bad, is that there are lots of products. I mean, there's nicotine water out there. There's new kind of nicotine kind of packets that you can just
Sticks and strips.
Sticks and strips that you can suck on, and other kinds of things that you can do. Ravel was a smokeless tobacco product that people touted as it's safer. So the tobacco companies are also, and other companies are trying to kind of create products that look safer or can lure people into using and getting addicted to the nicotine.
Well, and going to his point, when you were in the counties that you talked to us about, what are the parental attitudes to this data that you're giving them?
Well, we're talking to the professionals mostly, but we're asking them to go talk to parents. So when you present some of this data to the PTAs and some of the others, they really do, it wakes them up a little bit. As Dawn said when she was doing some of the focus group stuff. So I do think that the information needs to get out there about this data, and that's partly what we're trying to do. We don't go directly to the parents, but we're trying to get the locals to get to the parents and to get to the prevention programs.
You know, it strikes me as a parent, and Janie and I were just speaking before, neither of us were aware of this problem, and we both have young adults as children. But for instance, certainly in Baltimore City, Baltimore County, Howard County, using billboards and metro and those mechanisms wouldn't reach a number of families.
Mm-hmm. Yeah, we have worked with, I mean, there are local groups. So in Howard County, for example, there's a drug-free Howard County group that we've kind of contributed some information about cigars to their materials that they're sending out to the parents. They have a website and kind of distribution, email distribution of their newsletter. So we've put some of those things in there. I mean, I think it really takes the local groups to get invested and understand about it and really go out there. We've had some of the people who do prevention in the schools have been in our meetings, and they are interested in getting this material and bringing it back into the schools and doing things with the schools. So I do think there's more. I mean, this was rolled out last year, so it's still relatively new.
And I think, getting back to your original question for a moment, that we do really need to correct misperception among multiple products. And one of the things we haven't talked about here today is hookah. And as Carlo said, his daughter said on college campuses they feel that cigars aren't that dangerous. I spoke to a group of 7th graders a few weeks ago, and they brought it up, and they said, oh, well, that's not dangerous. Hookah's not dangerous. So I think there has been so much focus on cigarettes that we really do need to correct misperceptions around other tobacco products.
There's a question here in the audience.
Please.
I have a question about outreach to medical organizations and practitioners, particularly the professional pediatric groups, and if that's underway also.
So, well, certainly our locals, pediatric groups know that a little bit because we've actually been talking to them at University of Maryland, and mostly in the residency program. But it would be a wonderful thing. We've actually tried to kind of get on some of the medical, Maryland medical meetings to try and present some of the information about that. We have a fax to assist program for quit lines that we've tried to kind of get on there. It's not easy to do. It's not easy to break in. You need some advocates or champions probably inside the organization to kind of do something with that as well.
Certainly taking your ad campaign into posters that could go to pediatricians or to school health suites seems like a relatively low-cost way of educating both the school nurses and the health educators in the school and et cetera.
And we have those, and we have distributed a couple thousand across the state in libraries and other community centers and community-based organizations too, to really try and get the word out on the ground everywhere.
Another audience member has asked that is interested in looking at sort of social influences and initiation and maintenance of smoking, and comments that in general African American youth tend to initiate smoking after graduating from high school, while white youth initiate before graduating from high school. Why do you think this is the case?
That has been the data. I mean, it's not that they don't initiate, they initiate at smaller numbers usually. I mean, we can tell the difference between Prince George's and Baltimore City and Prince George's County and the other counties here in terms of initiation. Usually it is lower of smoking cigarettes. I'm not sure that the same is true. I mean, we saw the African American rate across the state. It's higher than whites, and it's for the cigars. So I think again, product differences are there. The other thing that happens, I think, is that there's a very strong marketing campaign to African Americans for menthol cigarettes. And that probably kind of picks up a lot of people later as they're after high school graduation. It isn't limited to below that. I mean, the menthol cigarette isn't necessarily a chosen cigarette for the youth, but it does end up being very much marketed to that group. And the industry protected it, as you can see in the FDA, that it's the one thing that it was not considered a flavor, and so it was protected. So I think there's different marketing techniques. I think there's also cultural issues here in terms of what kind of things do you do and what don't you do, and then when do you pick these up. So it is an interesting pattern, and you know it. We don't know exactly why that pattern is there.
So I'm assuming it's illegal to sell these products to minors.
Yes.
And if, in fact, minors are buying them at these convenience stores and gas stations and things. Where's the sort of police enforcement or the prosecutorial enforcement at the level of the franchise owner or whatever?
Well, the locals are supposed to do the enforcement. So it's local police and other kinds of, some of them are, it depends on where enforcement is put at the local level. So sometimes it's the police, but sometimes they're health department, other health department people, I think, have been asked to go in and look and see if they can kind of sanction things. There are stings that people do. So you send in underage kids to buy, and they kind of then make a citation for the group. So there's some enforcement things out there. Unfortunately, with the cut in tobacco funds by the legislature and the loss of a lot of the restitution funds, there's a lot less money for enforcement. So each of the counties gets only a certain amount of money, and you have to allocate where exactly it's going to go. But the CDC actually has a goal for enforcement and tries to kind of encourage the enforcement piece.
Additionally, FDA Center for Tobacco Products does have a national enforcement program, and the Alcohol and Drug Abuse Administration for Maryland is responsible for that. So they are going out and doing checks on sales of tobacco products, product placement, any bans on advertising restrictions, things like that. And that all gets reported back to FDA, and FDA does send out citations, but one administration is responsible for the whole state.
But it's just a regulatory citation. It's not enforceable in court or...
I think at this point that's what FDA is doing.
They're fines. I mean, they have some fines that they have to pay.
Any other questions? This has been a wonderful Grand Rounds. Thank you so much, and I hope this will be an ongoing conversation with you two. Thank you.
Great.